study the pharmacokinetics, especially you might have learned it in the UG, but especially in the UG will go in little detail, especially the pharmacokinetics. Then what the definition and other thing you know very well. What the body does to the drug is the pharmacokinetic, whereas what the body does to the what the drug does to the body is pharmacodynamic. That's the very simple definitions. So pharmacokinetic is the quantitative study of definition. So it is the quantitative study of the drug movement in, through and out of the body. That's the classical definition. See, and the intensity of responsibility is related to the concentration of the drug at the site of the action, and when it is turn dependent, that's the kinetic properties. So any drug which need to act on the any system of the body, a sufficient concentration or minimal effective concentration should be there at the site of action. So that is depending upon the pharmacokinetic parameters, because how much quantity is absorbed, how much quantity is in the blood, and what is the quantity excreted in feces, how much quantity is metabolized, then what is the pK and pH of the drug, and many more things. They decide the quantity of the drug to be present at the site of the action. Then, so this is the interrelationship of the absorption, distribution, binding, metabolism, and excretion of the drug, and its concentration at the site of observation. So a drug should reach the site of action. Suppose the atropine sulfate, a parasympatholytic drug, should reach the receptors, especially on the salivary gland. Then the dose of the atropine sulfate should be in such a way that the minimal effective concentration should be reached at the site of action. So to simplify this thing, suppose a drug you are using in case of mastitis, that is the antibiotic. So after the culture and sensitivity, you have to select the drug based on its pharmacokinetic property, or else in vitro there may be very high sensitivity may be there. But what happens, your in vivo action depends upon so many parameters, especially the pharmacokinetic. And whenever there is a mastitis is there, then the antibiotic in the initial stage should reach the site of action, that is the alveolar cells or the milk producing cells, wherein which the bacteria are located. So or else it will be totally a waste effort. So to reach the site of action, the antibiotic should have and also not only reaching the minimal inhibitory concentration at the site of action should be reached. So here, that's why the drug is the dose is adjusted in such a way that the quantity of the drug will reach the site of actions, especially maybe the receptors or the enzymes or the cell organelles or maybe any other thing. So usually the absorption, that's the first phase, especially when we are referring to a drug. Then maybe any route, it is depending upon the type of the administration, that is the oral, then parenteral, two routes are there. So the absorption should take place. Then there is called as in kinetic, it is called as the one compartment model, two compartment model, and multi compartment model. And here the body entire is considered as the central compartment. So central compartment is the blood. So absorption, after absorption, the drug reaches the blood. So the drug will be in the free form or the bound form. So usually the plasma protein binding, so whenever the drug is bound to the plasma globulins, that is not available for to act at the site of action. Am I right? Then because it cannot pass the small molecular pore size. So the free drug, what here they are referring is the free plasma concentration of the drug. So then it will go to the tissue reservoirs. Usually whenever the drug is absorbed into the circulation, wherever there are entries, the drug will enter. So depending upon it is hydrophilic or the liphophilic and many more, they are going to the reservoir. There will be a balance between the reservoir and the blood, actually here the central compartment. Then there will be simultaneously all these are happening. So there will be biotransformation because the blood will be also pumped to the liver, and you know that the biotransformation takes place there, and here the drug is converted to its metabolites and ultimately it is excreted through the varieties of the organ, maybe the kidney, especially in case of the hydrophilic molecules, kidney, whereas lipophilic, it is excreted through bile. So these are sometimes the kidney or bile, or many more routes of the excretions are also there. So then another thing is there is a equilibrium is set between the protein bound drug or plasma proteins or the globulins. So a quantity, suppose if you take the thiopental sodium, 90% of the drug is bound to plasma protein, which is not available for the action because the plasma protein bound drug cannot cross the blood-brain barrier because of the more molecular size. Hence, the free drug is there in the blood and it will pass the blood-brain barrier and act. Whereas there will be a equilibrium between the free drug and plasma protein drug always, because the plasma protein binding loosens as the time advances. So once again the free drug is received. Then especially the unwanted site of action will be reached. For example, the most of the barbiturates, they are distributed with the immediately after administration. They are highly lipophilic and goes and lodged in the adipose tissues. So there will be a equilibrium between the adipose tissues and also the blood. So as soon as the concentration of the free drug reduces in the blood, it is reversed. Means from adipose tissue, it is coming back to the blood fold as free drug and readily available for the mechanism of action. Because of this property, after thiopental administration, during the recovery phase, once again the animal will go to the sleep because of the unwanted site of the action. The drug is trapped there, and ultimately the tissue reservoirs, they also make the balance. And the therapeutic site of action, this is very important for us because the maybe receptors, enzymes, or the other cellular organelles, especially ATP and other things. So the drug is going to act on this particular site or the receptor. So once again, there will be a competition between the bound and free form, and the free form is the one which is going to occupy the receptors and do the action. So ultimately, after this action, there will be always the equilibrium will be maintained between the blood and also the site of action. And simultaneously, all these reactions are going on. The absorption will be going on inside. Suppose the drug an antibiotic, take an antibiotic or enrofloxacin. So the absorption of the enrofloxacin starts as soon as it is administered, and after 10 to 15 minutes, it reaches the duodenum. Then it starts absorption, and after 1 hour, the peak plasma concentration will be reached. Then what happens? There will be a free form and bound form as usual. So all these the balances, especially a balance between the tissue reservoir. Suppose there is a lead, it will be always bound to the bones, whereas the unwanted sites are also the sinks, especially. So ultimately, after some time, the drug gets excreted out of the body. That's called as absorption. Then distribution, especially in the different tissues, then biotransformation and excretion. So these entire four components make the pharmacokinetic of a particular drug. So this is depends upon the chemical nature of the drug. It is the, and also many factors which are in detail we'll discuss this particular thing. So there is always the balance is done in between the bound form and free drug. So the site of the actions also may be receptors, enzymes, and many more. The free drug is going to act, and after some time it will get detached from the receptor and it will be in the general circulation. When the drug is in the general circulation, it will also circulate in the liver. Hence, it is the metabolism occurs here. So the metabolism, after metabolism, the metabolites of the drug are excreted through the urine after the biotransformation. So there are varieties of the drugs, metabolizing enzymes are there, CYP 450 and many more. So as usual, the earlier it is also told that the equilibrium is being always tried to be maintained between the free drug and protein drug. So the drug usually there will be a dosage form how the drug is going to be administered. That's the physical form of the drug, and it dissolves in the absorption site. Then absorption takes place. So then distribution to so many tissues. At the same time, it will reach the site of the action, and also simultaneously the drug metabolism and excretion takes place. So the excretion of the drug is taking place through the urine or also maybe the many other routes. Then here there is a diagrammatic representation how the absorption takes place. So the transit of the drug, especially along in the intestinal mucosa, maybe the gastrointestinal mucosa, and here varieties of the cells are there. So especially in the intestine, the mucous layer is there which is coating the cells, especially the enterocytes. All these are enterocytes. So these enterocytes do contain the nucleus and also the transcellular transport system. So and also sometimes the influx pumps are there to push the drug against the concentration gradient. So this applies to almost all the chemicals which come in contact with the intestinal wall. So what happens is, suppose it is a carbohydrate or sugar or protein, they will also come in the contact with the intestinal layers, and the mucus layer is the one which is going to prevent the absorption, but it depends upon the type of the molecule which pass this mucus. Then usually it is like this bacteria, the virus, the fungi. Also there, especially in the intestine, varieties of the bacteria are there, which are, some of which are very much wanted and some of which are not required. They may be the pathogenic organisms. So apart from this one, there are the varieties of the enzymes which are going to helpful for the digestion of the food. Of course, certain carrier molecules are also there, then bile salts, then microbia and this condition, and food and digestion the products, especially in the carbohydrate, the glucose is the building block, whereas in case of the proteins, it is amino acids, especially in case of the fats and free fatty acids. All these are absorbed into the circulation. So suppose what happens is, suppose here glucose is absorbed, then then it is pushed into the blood because there may be more glucose inside the blood. But in spite of that thing, since the glucose is required very much, it is pushed inside using all these influx pumps. So there is a tight junction between the enterocytes in between, and sometimes there is a paracellular transport system is also there. In between certain cells, there is a loose junction is there. So the bigger molecules can also be absorbed into the circulation. So this is the capillary endothelial system which the drug is absorbed into the circulation and gets into the mainstream. So any drug which is given orally or any other route has to come to the heart first, then it will be pumped from there, then it will go to the entire body. So we cannot make any drug to reach the site of action directly, unless the dermal applications or the lotion, skin ointments. So they can be directly applied, whereas the other drugs, it is not at all possible. So this is the mechanism how the drug is absorbed and what are all the barriers are here. So absorption is the movement of the drug from its site of administration into the main circulation. So any drug which need to be acted on a specific tissue or the site, it should be absorbed first into the body of a animal or the human being. That is the first step. So not only the fraction of the administered dose gets absorbed, so the rate of absorption is also important. How fast it is absorbed into the circulation. So you are administering the drug atropine sulfate, for example. So if you are administering it orally, it takes more time. If you administer the intramuscular injection, it may take 5 to 10 minutes. Whereas if you administer it IV, then it is immediately the peak plasma concentration will be reached. So that's why they say that except when given IV, the drug has to cross the biological membrane. So many biological membranes are there. So the factors affecting the absorption are listed here, just like the physicochemical properties of the drug and formulation related factors or the properties of the drug. So the physicochemical property includes how much quantity of the drug is soluble in the intestinal fluid and also the stomach in presence of HCl, etc. Then stability of the drug. So there are varieties of the barriers are there, especially the drug need to enter the body, and especially the orally active drugs, they go to the stomach immediately after engulfing. Then the pH of the stomach is up these 3, it's very low. pH means it is highly acidic in nature. So this makes the drugs vulnerable to be destroyed. So that's why the word stability comes, how much the drug is stable. Then it should be stable throughout its excretion through the feces, and during the transit into the intestine, the drug should be very stable, or else it will be destroyed by the varieties of the digestive enzymes are there. It may become substrate to varieties of the pathogens also. Then the particular size, how much big the molecular size of the drug is there, because the intestines has got different pores, and the cells have got the tight junctions. Hence, if the molecular size is low with more and more solubility, then the absorption will be very fast. Just like the glucose. Glucose is one of the most simple molecule, and immediately after administration, the absorption starts from the mouth itself. So the dissolution rate, suppose the drug which is in the form of a tablet, capsules, or the powder or liquid, many things, dosage forms are there. So how much quantity is dissolved in the water, though that's also important. And the lipophilicity, how much quantity of the drug is soluble in the fat, or the pK, means the pK and pH refer to the dissociation constant and the pH. So the especially the acidic drugs are absorbed to alkaline, and also the vice versa. So this also makes a lot of importance. That's why, because this thing, the urinary alkalizers and other things are used for the more and more excretion of certain drugs. Then also the polymorphism, different forms, and also the molecular weight. These are all the physico-chemical properties of the drug. Whereas the formulation related factors or properties of the drug is like this: the type of the dosage form, or the whether it's oral, parenteral, injection, patch, dermal, and many more what you call as the dosage forms are there. Then how much viscosity the drug has got, whether it's too thick, medium, moderate, or the partitions, and the drug concentration in the formulations, especially how much quantity is present in the each unit. The dose, of course, it is one of the important thing. The larger doses, more drug is absorbed, and the quantity in which the drug is dissolved, that is the dose volume. So this applies to almost all the substances, drug substances, maybe the injection. So there some injections contain 100 milligram per ml of the oxytetracycline. Some preparations may contain 200 milligram per ml. So that's also the important constituents, content. Then the dose volume, how much quantity to be administered, and frequency is also very, very important, because this depending upon the plasma half-life, a peak plasma concentration or therapeutic concentration of the drug need to be maintained at site of the action for the prolonged period. That's why the dosing frequency is important, because as soon as the drug's concentration comes below the minimal effective concentration, then that should be increased to the original level by administering the drug in a fixed intervals. For example, the paracetamol, suppose if you administer, the half-life is in some 6 to 12 hours. So if you want to continuously maintain, especially this refers to the antibiotics, so the minimal inhibitory concentration to be maintained at the site of the action. That's the where the bacteria are present, whether they are present in the lungs, liver, kidney, spleen, and many more. So the whether the drug need to be administered once in a day, or twice in a day, once in 15 days, or BID or TID, etc. So the dosing frequency is okay. Then the excipients like preservative and penetration enhancers are also used in the tablet form, and other thing that's called as the excipients, which are used for making the bulk drug. Suppose the paracetamol tablet is containing 650 milligram of the drug, then if you weigh the tablet, it will be more than 2 or 3 gram. All the other things are the excipients. So the net osmolality. So the osmolality means the pH, of course, the dissociation constant, and how much quantity of the drug is soluble in different body fluids. So stability in the mucosa, especially in the nasal mucosa, which applies to the nebulizers, especially the net particle size and the drug release profile. There may be patches, there may be the injections or the tablets and many more powders. So of course, here also the pH matters a lot. So whether it's acidic or alkaline or neutral. So we'll deal especially all those things in detail. The factors affecting the absorption here one by one. Then the aqueous solubility means drugs given in the solid form must dissolve in the aqueous biophase before they are absorbed. So the aqueous phase is present in the body, and that in that particular environment, the drug should be soluble. Whereas the poorly water soluble drugs like the aspirin and griseofulvine. So aspirin, a NSAID, griseofulvine is a antifungal drug. The rate of dissolution governs the rate of the absorption. So more and more the drug is dissolved, then it is absorbed very fastly. A drug given as watery solution is absorbed faster than when the same is given in the solid form or as oily solutions. So the water soluble drugs are very fastly absorbed into the circulation from the oral route, if it is a oral route, and when compared to the solid forms. So the solid form of the drug means with excipients and sometimes the viscous liquid also it may be there. So the concentration of the drug, it is the passive transport depends upon the concentration gradient. Here, most of the time the drug requires the passive transport because the energy should not be wasted in the upliftment of the drug. The drug given as concentrated solution is absorbed faster than of the dilute solution. So area of absorbing surface, so larger the area of absorption surface, larger the absorption. So more and more surface area, that means to say surface area in which the drug is exposed to. So suppose if you consider varieties of the absorptive surfaces, the lungs has got highest absorptive surface next to the intestine. So the vascularity of the absorbing surface. So the blood circulation removes the drug from the site of absorption and maintains concentration gradient across the membrane. So the increased blood flow at the site of the injection or to the intestine, it increases the drug absorption just as wine hastens the drying up of the cloth. This analogy is given. So increased blood flow means more and more speed of the blood. So the more and more drug is absorbed. And route of administration, this affects the drug absorption because each route has its own peculiarities, just like the IV very fast, IM little slow, whereas the other drug routes are also there. And oral, coming to the oral route, the non-ionized lipid soluble drugs, example, ethanol, are readily absorbed from the stomach as well as the intestine. That means the drug which is in its native form, which is non-ionized, and it should be lipid soluble drug. For example, ethanol, readily absorbed from the stomach as well as the intestine, whereas the acidic drug like the salicylic acids, the barbituric acid, etc., are predominantly unionized in the acid gastric juice or gastric acids and are absorbed from the stomach. Whereas the basic drug with pH more than 7.4, just like the morphine, quinine, etc., are largely ionized and are absorbed only on reaching the duodenum. So they become very ionized. They carry some charges, and as soon as they reach the duodenum, the absorption starts. So the presence of food dilutes the drug and retards the absorption. So many times many of the drugs, maybe some of the enthalmatics which are administered to the animal, and certain, especially the antibiotics, example, the fluoroquinolones. It is said that these drugs should be consumed 1 hour before food. So, to avoid the hindrance of the drug for the absorption. And certain drugs form poorly absorbed complexes with food constituents. Example, the tetracyclines. Whenever they are administered orally, then the calcium present in the milk and food, they delay the gastric emptying. So it causes a chelation, especially the calcium and the tetracyclines. And thus most of the drugs are absorbed better if taken in empty stomach. So most of the drugs are absorbed when they are taken into the empty stomach, but it is not always indicated because many times there may be the gastric ulcers or the drug itself may cause irritation to the stomach linings. So we should take care that such irritant drugs should not be administered in the empty stomach. And highly ionized drugs, example, the streptomycin, poorly absorbed when given orally. Ionized drug, they are not absorbed properly. Then this is the diagrammatic representation, the administration of the different drug varieties, that is the oral administration of the drug and release and absorption. So here you can say that the tablets are in varieties of the forms. So the one of the terminology here is the enteric coated tablet. Enteric coated tablet. So this is a tablet which is wrapped with certain materials which is resistant to gastric juices. So that's called as the enteric coated. And the tablets and capsules are also absorbed, administered orally. And apart from this one, some of the drops, mixtures, then the solutions, etc., they are going to be administered. Whereas the tablet do contain a terminology known as the matrix, means apart from the drug, many other materials are also present in a drug formulation. That's called as the matrix effect. And the coated drug tablet with the delayed release. So some of the drugs and injections need the delayed release, especially the prolutan depot, which is the slow releasing of this progesterone device. It takes many more times for the absorption. Whereas the enteric coated tablets are designed in such a way that the drug should not be destructed, especially when it is present in the stomach by the gastric HCl. So many times, if the drug is administered without the enteric coated, immediately after contact with that of the gastric HCl, the drug will be lost. Hence, the technology is the enteric coated tablets or sometimes enteric coated capsules. So these are all the drugs. Ultimately, whatever it may be, they should enter the stomach as the diagram here indicates. So all the drugs which are administered through oral route should be in the stomach. Then after sometimes depending upon the solubility and many more phases, it is descending down into the duodenum, then into the lower intestine and also the small intestine, then large intestine, the colon, the rectum, etc. So all these especially they are going to affect the absorption property of a drug. Then there is a terminology is there, that's the luminal effect. So luminal effect is the formation of insoluble complexes. Example, tetracycline with ion preparations and antacids. So tetracycline should not be given along with the ionic preparations and also the antacids because it is going to be get chelated. So another terminology, that is the gut wall effect. So it is the one effect, means it is the one which is the altering the motility of the gut or gastrointestinal tract. So if you administer atropine sulfate orally to an animal, then itself will cause the decreased peristalsis and the effect will be hampered. Whereas the tricyclic antidepressants and also the opioids, then metoclopramide and antiemetic, so these have got causing the mucosal damage sometimes, especially the neomycin, methotrexate, and vinblastine, or any anti-cancerous drugs are highly toxic and they cause damage to the intestinal wall. So the metoclopramide is a prokinetic drug. It makes the relaxation of the sphincter of the stomach, and also it causes the peristaltic movement of the intestine. So it is a prokinetic. And subcutaneous and intramuscular injections. So by these routes, the drug is deposited, especially directly in the vicinity of the capillaries. So by this, especially the intramuscular or the injection route is one of the modern type of the administration of the drug. So why this is required is whenever there is an emergency situation wherein which we need the fast absorption of the drug, then we have to select either subcutaneous, then IM, then the last one is the IV. Whereas the capillaries being highly porous do not obstruct the absorption of even large lipid insoluble molecules of the ions. So the blood capillaries being highly porous, especially, do not obstruct the absorption of even large lipid soluble insoluble molecules and ions. So very opposite to that of the blood-brain barrier which is present in the brain, the other capillaries outside the central nervous system are highly porous and do not obstruct the absorption of even large lipid soluble drugs or ions. So very large molecules are absorbed throughout the lymphatics. So lymphatic circulation system is a totally different system that's existing in the everybody. So very large molecules are absorbed through the lymphatics. And application of heat and the another thing, that's the muscular exercise, accelerate the drug absorption by increasing the total blood flow. And while vasoconstrictors, example adrenaline injected with the drug, retard absorption. So many times these are made as the slow releasing device drugs and also less absorption. And the incorporation of the hyaluronidase, the enzymes, different enzymes, which are having the tissue breakdown effect. And hyaluronidase facilitates the drug absorption from the subcutaneous injection site by promoting the spread of the drug at the site of the injection. Suppose you are administered with the injection, maybe the IM, IV or subcutaneous route, then it will immediately come with contact with that of the varieties of enzymes, or else it can be mixed with the enzymes like hyaluronidase. So many depot preparations, example the benzathine penicillin you have seen, then protamine zinc insulin, depot of the progesterones, etc., can be given by the particular route, especially the depot preparations. So these are all the substances, whereas the topical sites are skin and mucous membrane. So other than the parenteral sites, like the absorption in mouth and also through the other organs, whereas the topical site includes the skin and mucous membrane, and the absorption can be promoted by rubbing the drug incorporated in oil base or by use of occlusive dressings which increases the hydration of the skin. So if you make the animal skin to be hydrated properly, then the absorption is promoted due to the rubbing up of the drug incorporated in oil base or use of occlusive dressings which increase the hydration. See, OPC insecticides coming in the contact with skin can produce the systemic toxicity, because we cannot say that it is not administered orally, because many times if it is applied on the body of the animals, then if the abrasions are there, then it may enter the general circulations. So the abraded surface, the readily absorb the drugs. Example, there is a tannic acid over the burnt cream, etc. Burnt skin is produced especially in case of the hepatic necrosis. So these are all the few of the things need to be followed, especially in case of the external application drugs. So many times you might have seen that the drug is instilled in the conjunctiva. So this is because the cornea is permeable to lipid soluble, unionized. Lipid soluble should be the first criteria. Second one is the unionized to ionized. So the unionized physostigmine, but not the highly iodized neostigmine. So there is a difference between the absorptive pattern. Similarly, the mucous membranes of the mouth, rectum, vagina absorb lipophilic drugs. So this is also another point. Even in the rectum also, some of the drugs are advised to give intra-rectum. And this type of the administration is for the increased what we know as increased quantity of the drug absorption. So next here is the term known as bioavailability. So what is bioavailability? It is the ability refers to the rate and extent of absorption of a drug from the dosage from the site of absorption. So this bioavailability is determined by its concentration, time curve in blood, or by its excretion in the urine. So the bioavailability is depending upon varieties of the factors, like the whether it is a substrate for the excretion, then how much quantity is metabolized and how much is available for ready absorption. So it is a measure of the drug fraction, that's denoted as the F of administered dose of the drug that reaches the systemic circulation in the unchanged form. So please remember that the bioavailability is a measure of the fraction of the drug administered dose of the drug that reaches the systemic circulation in the unchanged form. If it is changed, then the half-life becomes very more and they get excreted. So bioavailability of the drug, bio plus availability is the drug which is injected IV is 100%. Means there is no spillage or wastage of the drug. So whereas in case of the orally acting drug, it is differing a lot. Then another terminology, it is called as the bioequivalence. Bioequivalence. So the two preparations of a drug are considered bioequivalent when the rate and extent of the bioavailability of the drug for them is not significantly different under the suitable test conditions, because the two or more preparations of a drug, same type of the drugs, are considered as bioequivalent because the milligram per ml etc. remains the same. And when the rate and extent of the bioavailability of the drug from them is not significantly different under suitable tests. They should not be a minimal concentration of the drug. Whereas the oral formulation of a drug from different manufacturing units or the different manufacturers or different batches, in between the batch there will be a slight change in there. So the same manufacturer, he may prepare varieties of the drug, then a physicochemical property will vary a little. So the chemically equivalent but may not yield the same levels of the biological equivalence. That's another term known as the bioequivalence. How much quantity of the drug is present in different compartments of the body.